Hey everyone, my name is Alicia Jocelyn and I attend McNeese State University. I'm in the RN to BSN program, and this presentation today is going to be a discussion about how nursing theory affects nursing practice. So I work in an inpatient rehab unit. We have 20 beds and we see approximately 350 patients a year. So today we're going to be talking about Dorothy Orem's theory of self-care in relation to inpatient rehab. Dorothy Orem's theory of self-care is all about nurses promoting independence for the patient. Some key points about this theory are that she believed that all people are distinct individuals. She also believed that people should be self-reliant and responsible for their own care. Meeting self-care requisites is an important component of the prevention of illness. She also believed that an individual must be armed with knowledge about the potential problems that could come up to promote their own self-care. And she believed that nursing was an action. The four meta paradigms of nursing are person, environment, health, and nursing. So Orem's theory defines person as the individual themselves. Environment's a little bit different in this case. She refers to environment as the healthcare system where the nursing care is provided. Health refers to people when they're in their normal state and they're able to perform their usual activities. Nursing, according to Orem again, is an action. It's believed that nurses should choose interventions for their patients that are going to positively impact the patient's lives and health. So how does Orem's self-care theory fit into inpatient rehab? So I can think of a lot of examples, but I'm going to talk about two of those for you guys today. So one of those are FOM scores. FOM scores are functional outcome measures, and those are used to compare how the patients are functionally whenever they come in, during their stay, and then at discharge. So different items that are scored are eating, oral hygiene, toilet hygiene, showering, upper body dressing, lower body dressing, footwear, rolling left to right, sit to lying, lying to sitting, sit to stand, bed to chair transfers, toilet transfers, and walking 10 feet. Scores range from a 1 being dependent to a 6, and that would be independent. So the goal is to improve those self-care items to become more independent while you're in rehab. So I would say that's a perfect example of Orem's theory because the goal is to get better. So as rehab nurses, we're promoting that independence and we're using that FOM score to kind of get that baseline and see where those patients are going during their stay. So the second is the focus on discharge to community. So this is actually a quality indicator for rehabs. When DC to community is higher, this is a positive indication that the rehab hospital is providing great care. That means that these patients aren't going back to acute care. They're not going to a skilled nursing facility. They regained their independence to the level that they can actually go back home. So what are some examples of how concepts from Orem's theory of self-care can actually impact patient care in the inpatient rehab unit? So two examples are fall prevention and medication management. So using the concept of Orem's self-care theory, nurses in the rehab setting actually educate their patients on fall prevention. They get these patients involved, they educate them on the negative outcomes that a fall could have on their health, and they get them involved with the actual plan of care. The second is medication management. Again, the education portion kind of comes back into play here, but medication teaching is a great example of Orem's theory and how this applies to the nursing practice. We teach patients about the uses and the side effects of their medications, and we teach them about the importance of compliance and recognizing potential issues when they're taking these medications. We're empowering them to take their health into their own hands and be responsible for their own care. Thank you guys for taking the time to listen today, and I hope you have a great Easter.